So why can't we just implement a program to improve mental health outcomes across community? Well, I think that's a really common problem of so many communities and local areas trying to make change happen. And I think what's really important to understand is that programs are an outstanding strategy for improving aspects of mental health, but they are one piece of the puzzle. They're a really important piece of the puzzle, but they're part of a much bigger picture. So when we look to improve mental health, we need to consider all that goes on in a community or a local area. We need to think about obviously the needs and the issues that are going on. And that's where programs come in to address things. And they come in and they're utilised, and then they may change and may move on. But there are also things such as access to support services. There is things such as the sense of belonging and connection that happens, the welcoming nature of the community, the awareness and education levels of people within the community around mental health and wellbeing. So programs provide a place that we can tap into when we identify the issue that's going on. So, for example, at the moment, there might be an issue around youth, or there might be an issue to do with suicide prevention, or supporting those that support others. So thinking about how we can support different people. Now, we might get a program in for a short period of time to provide education, to provide intervention, whatever it might be. But the thing is that as the needs of our community change, so should the programs. But if they sit under an overarching program, then, an overarching process for change, then the process stays the same and just the programs change as the needs of the community change. I've seen so many communities that find that they've got an issue, bring in a program, and then when that program's finished, they're disappointed because the long-term change, the sustainable overarching change in terms of mental health and wellbeing hasn't been achieved. And that's because there is so much more to it. There is so much more than just the programs. And when we consider all of those other things around the programs, that's when we have success, because we really create, as I said a moment ago, long-term sustainable change and a community that values and really understands and wants to support the improvement of mental health and wellbeing. So that's my thought for today. I'll see you next time.